There are certain things many seniors say at a doctor's visit without realizing it can actually hurt their care. In this video, I'm going to break down the biggest ones and what you should say instead, because this isn't really about saying the wrong thing. It's about how small phrases can completely change how your doctor understands what's going on with you. And I've seen this happen over and over again. I've been a nurse for over 30 years. And if there's one thing I can tell you, it's this. Communication matters more than people realize. It's not just about what's happening in your body, but how you describe it. Because your doctor isn't with you 24/7. They're relying on what you tell them. So when certain phrases get used, even casually, they can accidentally minimize, confuse, or delay your care. Let's start with the classic, "I'm fine." And I get it. This is almost automatic for most people. But here's the problem. "I'm fine" tells your doctor nothing. And I've seen patients say, "I'm fine," and then 2 minutes later describe pain, fatigue, dizziness, trouble sleeping. That's not fine. That's information your doctor needs. I remember one patient in particular. She came in and said, "Oh, I'm fine." And as we kept talking, she casually mentioned that she'd been getting dizzy almost every day. She just didn't think it was worth bringing up. That's the kind of thing that gets missed when everything gets labeled as fine. What you could say instead is, "I'm okay, but I've been having blank," or "I feel mostly fine, but this has been bothering me." That one shift gives your doctor something they can actually work with. "This next one drives me a little crazy. It's probably nothing." And then they describe something that absolutely should be evaluated. Here's the issue. When you minimize your own symptoms, your doctor may unconsciously do the same. Not because they don't care, but because you've already framed it as not important. And I've seen this delay diagnosis more than you think. What you should say instead is, "I don't know if this is serious, but here's what I'm noticing." Now you're sharing without dismissing. This next one, I hear it all the time. I didn't want to bother anyone, especially when symptoms have been going on for days or weeks. This is exactly what landed my mom in the hospital with an ovarian cyst the size of a grapefruit when I was 16. Let me say this clearly. You are not bothering your doctor. That is literally their job. And I've seen so many situations where someone waited and waited and waited, and by the time they spoke up, the issue was much harder to manage. What you could say instead is, "This has been going on for a while, and I wanted to get it checked." Simple, direct, and helpful. Even better, talk about it when you first notice it. This next one sounds polite, but it can actually work against you. "Whatever you think, doctor," because now you've removed yourself from the conversation. And good care is a two-way conversation. Your doctor brings medical knowledge, but you bring your experience, your preferences, and your priorities. And I've seen better outcomes when patients stay engaged. I remember a patient who kept saying, "Whatever you think is best." And on the surface, that sounds cooperative. But when the doctor started explaining options, we realized there were things that mattered to her that she hadn't mentioned at all. Things that would have actually changed the plan, but no one knew because she didn't say it. What you can say instead are, "What are my options?" or "What would you recommend and why?" That keeps you involved without being difficult. And then there's my absolute favorite. And I know I say they're all my favorite, but really this one as a telehealth nurse, I Googled everything. This one goes both ways. Some people come in saying, "I looked everything up and I think I have blank 5 different conditions." And others say nothing. Even though they're worried, here's the truth. Your doctor knows you're thinking about it. It's okay to say, "I looked this up and it made me wonder about that." Opens a conversation instead of creating tension. And then I forgot. This one is very common. You get to the appointment and suddenly you forget half of what you wanted to say. And then later you think, "Why didn't I bring that up?" I've seen this happen constantly. Important details get missed, and those details matter. What you should do instead is write things down, even just a few bullet points, symptoms, questions, concerns, because your appointment is your time and you want to use it well. If you're not sure what to say, here's a simple way to think about it and to make notes about it before you go into the doctor. What am I feeling? When did it start? Has it changed? And what concerns me about it? That alone gives your doctor a much clearer picture. And here's a little insider tip. The more specific you are, the easier it is for your doctor to help you. Here's the bottom line. Your doctor isn't just treating your condition, they're responding to the information you give them. So, small changes in how you communicate can lead to better understanding, faster decisions, and more accurate care. And I've seen this make a real difference over and over again. And honestly, this is why I created my free guide, What to Say at Your Next Doctor Visit, to help you stay organized and advocate for yourself like a pro. There's a link down below. You can download it for free because knowing what to say and how to say it can completely change your experience. And I'd love to hear from you. What's something you've said at a doctor's appointment that you later wished you'd said differently, or something you weren't sure how to bring up? Drop it in the comments because chances are you're not the only one. See you next time.